Welcome to Sword and Shield, the official podcast of the 960th Cyberspace Wing. Join us for insight, knowledge, mentorship, and some fun as we discuss relevant topics in and around our wing. Please understand that the views expressed in this podcast are not necessarily the views of the U.S. Air Force nor the Air Force Reserve, and no endorsement of any particular person or business is ever intended.
Good day, Gladiators. Thank you for listening to another episode of the Sword and Shield podcast. It's Francis Martinez, Director of Psychological Health for the 960th Cyberspace Wing, here with two guests from San Antonio Behavioral Healthcare Hospital. I have Dr. Henry Polk. He's a board-certified child and adolescent psychiatrist, and Sara Broussard, licensed professional counselor. So thank you guys for joining us today.
Hi, thank you for having us.
Yeah, absolutely.
Yeah, so we wanted to have you guys today. March is Self-Harm Awareness Month, and I think it's one of the things that's a little bit most misunderstood. And that's why, I want to, have a podcast on and discuss like what it is, what it's not, and what it looks like.
Yeah. Well, we definitely agree with that and appreciate you letting us be a part of this forum. I know that, typically as a child and adolescent psychiatrist, and I know with Sara as a therapist, we often kind of get that bewilderment from parents about really trying to understand self-abusive behaviors and what it really means. And like you said, a lot of times that self-harm isn't about a kiddo wanting to end their life and really trying to help focus on kind of what it means for families, what it means for that individual kid, and what they're really struggling with, and trying to really find and get that picture and looking at those symptoms and getting down to the bottom of things of why it's truly occurring is important.
Yeah, and then when we talk about self-harm, right, we're looking at self-injurious behaviors, cutting, hitting, burning, biting yourself, pulling hair. Those are the things that we're really, talking and focusing on. And I know you guys like to focus a lot on kids because it really is prevalent in kids. I know about 17% of teens have admitted to one time in their life self-harming.
It's very, very prevalent in kids, but, a lot of times, and even with the research, we see it a lot more often in kids, but it's probably been happening a lot over the years, and a lot of, parents or adults, even kind of in secrecy, have engaged in those type of behaviors. It's just a lot more prevalent now because of the kids and the tweens, as we call them, kind of see more of that stuff in kind of the mainstream media, and so we see it a lot more often in that population.
And so where do you think that it really starts as far as age, that it really is, average age of child or adolescent that we see self-harming behaviors?
Well, that's a tough question to answer because obviously it's going to be different for every child. Probably 12 or 13, would you say? And this is just from our own experience, but it's pretty young. It's 11, 12, 13, which is probably when it starts.
Definitely that range, that 12 to 14-year-old range. And even nowadays, we could even see it in even starting from 9 years old, but probably on average it is between that 12 to 14-year-old age range when it becomes most noticeable.
Mm-hmm.
And do you see it more in certain genders, or is it, focused on or equal between the two?
So I guess it depends on how you operationalize self-harming, right? I primarily work with teenage girls, and that's going to look like cutting. But when we work with boys, I think it presents differently in boys. And so sometimes we'll see even like punching and headbanging. It's going to look like that. But I think when we think of stereotypical self-harm, we think of teenage girls, and it looks like cutting. And
what are some risk factors that we're looking for when we're talking about self-harm?
I think when we kind of really look at self-harm and we kind of discuss risk factors, it's a lot of times it's that, from a parent's perspective, they look at it as, their kid is in distress, they're suicidal, they need this immediate help. But from our standpoint, we kind of look at cutting as almost a symptom of something more, whether it's an underlying anxiety disorder, depression, a personality disorder, A lot of times we look for those cues and signs of any type of trauma, whether it be physical, sexual, or emotional. So generally, you look for those warning signs related to, are they wearing long sleeves at school? Are they being more isolative or having more friendship difficulties or decreased grades and wearing winter clothes during the summertime? So those are some of those signs that we really try to tell parents to really try to help to identify, this change in behavior or change in kind of their appearance at times.
And is it something that, when we're talking about self-harm with kids, is it something that we continuously see throughout? Okay, well, if my kid's a cutter at 13, when they're 25, they're still doing that. Or is it, some people might think, oh, they're going to outgrow whatever. Or, for those people that don't believe in any type of, mental health conditions or disorders, what does that look like?
Yeah, so lately I've been working a lot with older teenage girls, and when I ask them about their history of self-harm, when they say, no, I don't do that anymore, I stopped, I always ask them, what helped you stop, or why did you stop? And 99% of the time it's peers. So I don't know exactly why. I don't know if it's adolescent brain development or it's, changing values, changing social situations, but we start to see it sort of taper off by the time adolescents get into the older teenage years, right? Wouldn't you say, Dr. Polk?
Yeah. And we think that probably has a lot to do with it. It just doesn't magically just disappear. It's one of those things that, as that adolescent brain matures and that emotional age finally catches up with that chronological age, they're able to kind of instill more coping strategies instead of kind of using that self-harm as a way of managing their emotions.
Yeah, for sure. You said, Dr. Polk, the coping skills or strategies. I don't think people realize that cutting or hitting or burning and biting yourself, those self-injurious behaviors are really coping skills. They're just maladaptive, right? And so replacing those behaviors with something positive is what we're, looking to work on. And so what are some ways that you guys find has been beneficial with substituting, negative coping skills with positive?
Oftentimes I talk to the girls about, I'm really into yoga and exercise, right? And so oftentimes I talk to the girls about getting that proprioceptive and somatic feedback through exercise because it still burns. You still get the endorphin kick. So that's something that I really push, and we do movements in my groups as well. But I think any sort of expressive therapy, anytime the kids are expressing themselves, whether it be through music or art or dancing, that's really helpful, especially for teenagers. Writing, journaling, they just got to get it out, right? And so something that we really encourage them to do here is to practice expressing themselves in other ways and practice experiencing what that dopamine kick might feel like if they're doing push-ups or if they're playing volleyball. Like, what does that feel like? How do you feel afterwards?
Yeah, and just kind of to kind of piggyback on what Sara said, and she absolutely agree, is that that self-harm behavior is actually kind of when it hits those receptors, and kind of the simplified version is that they kind of get this endorphin rush, which kind of, causes them to kind of go back to that behavior because, a lot of times those kids that are really struggling with that ability to be able to have, coping skills that are more productive in nature, they kind of go to the cutting and it kind of reinforces that feeling with the increase in the endorphins, and really being able to understand that and help the parents to understand that, and kind of all those other healthy coping mechanisms that Sara was talking about kind of helps to replace those things to kind of mitigate them having that response over time.
It's actually really interesting. The kids talk about it as if it's addiction. Have you noticed that? They'll be like, oh, I've been clean from cutting for 4 months. And they use addiction language and recovery language, which to me just, underscores even more what Dr. Polk is saying about that neurofeedback and just the way that it's really affecting their little bodies.
And I think when we talk about self-harm, a lot of people want to connect it to suicide. Oh my gosh, they're doing this, they're going to hurt themselves or commit suicide. Is that a myth? I mean, is that something that we look at, that just because you're doing this is does it mean that you are going to, commit suicide, or what are the risk factors there?
I think that, when we look at self-harm behaviors, really trying to get a better sense of what the true underlying problem is and assessing that, and always, making sure to err on the side of safety and kind of, looking at all the different risk factors for each individual that's experiencing self-harm behaviors, and really trying to get a good assessment to see whether or not it is it this parasuicidal behavior, or is it this way of this maladaptive coping where they're not really dealing well with the emotions and being able to verbalize it, and they rather feel this physical pain as opposed to this emotional pain, and kind of taking each individual and really trying to assess that to make sure it's not that type of suicidal behavior that needs more intensive treatment, like an inpatient setting.
And is it something that, I'm worried my daughter's friend is doing something, right? And then now my daughter's starting to do that. I know there's a theory of, like suicide contagion. Is it the same with self-harm?
Well, I probably think one of the most important things is that, it's one of those things that, when kids and adolescents are around each other, it's like I said, if we kind of use that addiction model, then, you have these kids that they hear their friends try it, so they want to try it. And so I think the main takeaway point, especially for parents, is to have that really open, honest discussion. If you know that your child is self-harming, to be very open and supportive and acknowledging and direct, and really try to address that in a way that's going to help them to open up and communicate, to kind of make sure they're getting the right treatment and having better ways of coping.
And what does the treatment model really look like for helping people to recover from self-harm?
I know Sara and I were talking about this earlier, and kind of the some of those main things, and it's getting down to the underlying issues, whether it be major depressive disorder, bipolar disorder, personality disorder, sexual trauma, eating disorder, or any other type of addictions, and really kind of addressing those underlying things and making sure that if medications are indicated, doing those, but then really trying to help them develop more appropriate coping skills, and really trying to get, we were talking about kind of families involved, because it's something that doesn't change overnight. It's something that has to be a family approach.
Absolutely. Any therapy with adolescents and children is really family therapy, right? Because they don't exist in a vacuum, and parents can play such a crucial role in facilitating that healing and that recovery. It just takes a lot of work on the parents' part too, right? So oftentimes we suggest that parents get treatment, that family therapy is involved, so that everyone can be on the same page, everybody can be communicating nonviolently, and just really supporting the child as much as possible.
What do you guys feel like the biggest challenge is when you're working with kids that do self-harm? What are our most at-risk kids, or the biggest challenge in working with this population?
I always kind of go back to communication. And when I say communication, that's all around. So when we're kind of looking at the child individually, them being able to kind of communicate with themselves. And what I mean by that is kind of learning that self-care, learning that self-love. We kind of have that philosophy here, is that, you need to learn how to love yourself so you can have a better relationship with yourself, so you're able to communicate what those emotional needs are to others. And that communication with family, making sure they're understanding and having a good treatment support team around them is what it really takes for those things to get better.
And so if someone is coming in and is needing, treatment, how do they go about getting that treatment there at the San Antonio Behavioral?
Well, I think it depends on the level of care that they need, right? So if they're coming in and maybe they self-harm every once in a while, or they're not really posing a big risk to themselves or to others, then we would send them over to our partial hospitalization program. And there they would engage in an outpatient program where they meet in groups and with individual therapists throughout the day, and then go home and have dinner with their families and rest, and spend time with their families and recuperate. However, if their self-harm behaviors are posing a bigger risk to their safety, or it's coupled with some pretty severe suicidal ideation, then we would admit them here, and they would start treatment here I think it really depends too on if you can keep yourself safe or not, right? So one of the benefits of inpatient psych is that we can keep you safe, and we do provide a really supportive and safe environment where folks don't have access to things that might hurt them. So I think that's kind of right where how we would help folks get started.
Yeah, looking at those individuals that are struggling and really kind of trying to assess that individual kid to see kind of what level of care they need. If those of course, if we see those they're more suicidal, there's more risk factors, and going to that least restrictive environment that's going to keep them safe is definitely what we always kind of indicate. Especially when you have kiddos that are still trying to develop their self-identity and trying to help them to kind of struggle, or to help them to be able to kind of communicate those emotions and needs more to family. And it really is not only just a family approach, but as a community as well, making sure that families have access to the different resources available to them, whether it be through a school counselor, whether it be through their pediatrician or a friend, but really kind of having open discussions like we're having now about and not just making it a secret, really kind of talking about those things so kids and families feel more comfortable in seeking help and care.
Yeah, absolutely. I don't think so here at the 960th Cyberspace Wing, every month we try to recognize any type of awareness or prevention. And there's just not a whole lot of data on self-harm in itself, right? Like, it's a phenomenon that hasn't been studied for a very long period of time. And it doesn't have a lot of, a whole lot of data to support it, or a lot of even recognition. So I don't think a lot of people really know about this, maladaptive coping skill. And so, that's why we're really just trying to educate, and we're trying to get on the forefront, right, of education, prevention, before it turns into an actual act.
Yeah, and kind of that goes back to, the families with their children kind of learning to have that open dialogue and talk about, changes, talk about, do you have a friend that engages in this type of behavior, and really kind of helping them feel more comfortable in opening up with how their children or loved one is coping.
Yeah, I still get kids who come in and say, "Oh, my parents say I'm just doing it for attention," and that's a cue to me that we need some education, and we need to kind of all get on the same page, like Dr. Polk said, with communication and understanding that. I mean, maybe it's a cry for help, but it's also maladaptive coping, and it's, unfortunately, like we talked about earlier, effective coping. So the conversation needs to shift away from attention and toward healing and coping. Yeah.
And so, we've talked earlier in the month about cultural diversities as it relates to mental health, right? And so those are going to be some of the challenges that our kids are facing when trying to get, treatment, or their parents don't believe in treatment. Can you guys talk a little bit about those struggles that you guys might see for the kids that want the help?
Yeah, it's tough. I think that sometimes parents think the kids don't need help, but after going through our services, their eyes open a little bit more. And I do a lot of work with families in trying to bring attention to the stigma and try and move through it, acknowledge that there's a stigma there and move through it. Obviously, race and ethnicity are tied to socioeconomic class. And I think a lot of the barriers that we see is really about income and financial status, unfortunately. That's just where we're at right now as a society. That also plays a huge factor in access to healthcare, just being able to afford it and transportation to get there, right?
Absolutely. And then, one last thing, the pandemic has put a big, strain on the lives of kids, right? Especially those that have to attend virtual schooling, can't see their friends, can't, do much activities. And so have you guys seen like a rise in this last year as it relates to self-harm?
Yeah, absolutely. With the pandemic, we are, without kids having that normal socialization and being able to navigate life and be able to learn how to interact and cope appropriately, and kind of being isolated related to the pandemic, it really kind of hinders their ability to be able to kind of have that brain development to be able to kind of mature in a way that's healthy. And so we're definitely seeing an increased number within our acute and other settings that we're seeing a lot more of this self-abusive behaviors because of how the kiddos are coping with the current situation.
Yeah, well, we're really trying to get ahead of it, trying to educate, like I said, educate people on different preventative measures and different, negative coping skills, and then flip that into, teaching those positive coping skills. And so listeners, gladiators, if, you're needing to reach out for help for your children or even yourself, right? Because some adults, they still have those maladaptive coping skills. Please reach out, and we can put you in contact with San Antonio Behavioral if you're local to the JBSA area. And if not, we can go ahead and definitely get you some treatment options in your local area. So I want to thank you, guys, for joining in today.
Yeah,
I really appreciate you. Yeah.
Well, thank you for letting us be a part of this.
Yeah, absolutely. And so to my gladiators, if you or someone you know are contemplating suicide, contact the National Suicide Hotline at 1-800-273-8255. Again, that's 800-273-8255. And thank you guys again for joining in with us today on Gladiators Out.